Hard to wrap your mind around it, but it's been 2 years now since the first COVID-19 cases were detected in China. Now, this new variant, Omicron, continues to spread. Question on everybody's mind: will we ever get back to the way life was before COVID? We did reach out to 3 doctors today who've been a large part of our coverage from the beginning, and our Brooke Cat shares what they have to say about the future.
We have learned so much since 2019 BC, before COVID.
Dr. Robert Gottlieb at Baylor Scott & White researched several experimental therapies, including remdesivir and monoclonal antibodies, treatments that are used in hospitals right now.
And we are at a much safer place now because of the vaccines. During that first year, we also learned about ways to care for COVID-19 patients. We learned fundamental things about how to treat the virus.
The world as we knew changed in 2020. We faced lockdowns, crowded hospitals, and rising case counts. We learned to accept masks, work and learn virtually, and hoarded toilet tissue. Now, 2 years later, we have not 1, but 3 COVID-19 vaccines, a technological marvel, says Dr. Diana Cervantes at UNT Health Science Center.
And I think, honestly, it delivered well above beyond what we expected.
Still, around 30% of the U.S. population remains unvaccinated, according to the Mayo Clinic. In Texas, just over 60% of the population is fully vaccinated. With those numbers holding fairly steady, there appears to be a shift in the mindset about vaccine hesitancy among doctors, and a realization that not everyone is going to get a shot.
We don't need to try to prevent every single infection. What we really want to try to do is prevent severe illness, hospitalizations, deaths, and that way we can have a good balance of, staying healthy, but at the same time living our daily lives.
I think masks will ebb and flow according to the amount of virus in a community. But I do think over time, over the course of several seasons or several years, I think the masking will be less required medically.
There appears to be a mindset shift in the medical community and acceptance this isn't a pandemic, but that COVID is endemic, meaning the virus is here to stay. That's what Dr. Joseph Chang, the chief medical officer at Parkland, believes we'll see happen.
I think, in my mind, the thought that we might get rid of COVID, I think we're beyond that at this point. People will begin to feel, you know what, this is endemic, and then we're going to start talking about it that way.
Dr. Gottlieb expects researchers will develop variant-specific boosters and customize them each year.
There's no reason why we can't actually vaccinate against a couple of key sequence strains or key sequence variants from the virus.
Until then, all agree we still have to protect ourselves and others around us.
We want to get it to the point where we've controlled it as well as flu, and it stops filling up our hospitals. I think that's where we really realistically want to get.
Brooke Katz, CBS 11 News.
And doctors say what you probably already know, and that is the variants are going to keep generating as long as the virus keeps replicating. Omicron, as you've heard, found to be extremely transmissible, but doctors say most people with Omicron end up with mild symptoms, so that's a good thing. Doctors are worried about the spike in cases, though, as we enter the holiday season. So many people are going to be coming together. They say a vaccine is still your best line of defense.